In this presentation, I'm going to go over spine and nerve injuries. So I'm going to provide an overview of the anatomy of the spine and recognize the signs and symptoms for spine and neck injuries and how to provide care for those injuries. Just so you know, I'll cover the neck and neck anatomy and injuries in another presentation. So our spine anatomy, just some background about it. The purpose of the spine is to provide strength and shock absorption. So every time we walk or run, that force has to move up the body. And so the spine is another way for the shock from us landing, our feet hitting the ground, way that force is dispersed through our body. The spine protects the spinal cord, which provides neurological information to and from the brain. Just remember that nerves send signals and receive information from our bodies. I think I've said in one of the other labs that the nerves send signals to our muscles that cause our muscles to contract and expand so they can move. They send and receive information about the sensation of our skin, and they also innervate or send and receive information about how we touch things, not only when somebody touches us, but when somebody else touches us. So all that stuff is coming from our brain down the spinal cord out through each of one of the vertebrae, which we'll talk about in a second. So here's our spine. There are 33 vertebrae in our vertebral column, also known as the spine. You can see the picture of the spine, the vertebrae in the picture there. So we have 33 total vertebrae. 24 of them are movable or true. 9 are immovable. And they're broken up in these 3 different areas. The cervical spine, which is our neck, is made up of 7 vertebrae. The first 2 are different. The C1, they're numbered by their order. So C1 is the one on the very top. This is where flexion, it's called the atlas. It's where flexion and extension of the neck take place. And C2 is the axis. It's where rotation of our neck takes place. So again, the cervical spine is our neck. There's 7 vertebrae there. Next area is our thoracic spine. There's 12 vertebrae. They don't really have much of a range of motion. This is what we would consider our upper back, from about where our neck ends and where our upper back starts. And again, has very little range of motion here. Our lumbar spine, this is what you would think of as your lower back. There's 5 vertebrae, which provide support for the lower back. We have trunk flexion extension, trunk rotation, and trunk lateral flexion, all taking place here. And this is the site of a lot of injuries for our athletic population and in general, in everyday population. Next area is the sacral spine. We have 5 fused vertebrae. We've talked about the sacrum and the pelvis area. Again, it articulates with the ilium to form the SI joint, as we talked about in previous presentations. And our last one is the coccyx spine, which is our tailbone, and there are 4 fused vertebrae there. So that's 33 vertebrae in our spine or vertebral column. Now, within each spine, between each spine, there's this intervertebral disc. So it provides cushion and shock absorption. This is what kind of keeps our bones from hitting each other. And it's made up of 2 main components. I think of the intervertebral disc as a jelly donut. So if you look at the picture On the right of the two pictures, the inside or the jelly portion of the vertebral disc is the nucleus pulposus. I call that the jelly. And then the outside of the donut or the disc is the annulus. So that's the donut portion of it. And so that's our disc. There are a couple conditions just want to make you aware of. We have lordosis. This is sway or flat back. I just recognized a mistake in my thing. It says we have a lordotic curve, and you can see how the person's back is swayed there at the lumbar spine. We have kyphosis. This is called hump back. We have an increase in the kyphotic curve there at the upper back. Scoliosis is a lateral curvature of the spine, so we have an S-shaped curve for this. Just some things to be aware of. Now we're going to transition into our injuries. So we're going to talk more of the thoracic, the upper back, and lower back. We have sprains and strains, and it's really hard to tell the difference. You can't really tell if somebody sprained their muscle or sprained their ligaments, because there's a ton of ligaments and there's a lot of muscles. So it's hard to tell the difference between them. But the MOI is the same: sudden compressive loading, so jumping and falling really hard, extensive massive extension with rotation are the main ways that somebody will tear a muscle or stretch a ligament. Some other factors that cause injuries to our upper and lower back is weak or poorly conditioned trunk and abdominal muscles, tight hip flexors or extensors, just being out of shape. All those type of things can lead to a back strain. So our signs and symptoms for somebody who's got a back strain or sprain, let's call it strain for clarity. So we got the pain, swelling, point tenderness. As most injuries, the muscles can start spasming. That could cause the person to have a lateral shift of the spinal column. They can lean over to one side because it hurts too much to put their trunk up, or they can lean over. Decreased amount of walking, so that would be decreased passive range of motion, decreased active range of motion. It just hurts to walk. Everything hurts when you have a strain to your back. So there's not any movement that doesn't hurt. The thing that's going to separate this from a herniated disc is no shooting pain down the back of the leg. No shooting pain at all. It's just all in the back. This can also be an SI joint problem too. So it's really kind of hard to tell the difference between an SI joint and just a muscle strain. So we initially will ice the person, then we'll use moist heat packs with ultrasound and electrical stimulation to help relax the muscles. We need to get on increasing their flexibility, their range of motion, and their muscle strength as quick as we possibly can without pain. Back injuries are one of the leading causes of just regular people's in athletics injuries, and makes physical therapists and doctors a ton of money because they're seeing a lot of patients with back and low back injuries. This is another one that causes a lot of pain for people. It's intervertebral disc herniation. We'll just call it a disc herniation, the herniated disc. So with this one, the nucleus pulposus, the jelly, squeezes out or bulges out of the annulus, the donut of the jelly donut. It squeezes out, as the picture is showing. And then the jelly pushes on the spinal cord or the nerve root. And this is most common between the L4 and L5, because remember, there's a jelly donut between each one of the vertebrae So it's between lumbar 4, lumbar 5, and lumbar 5 and sacrum 1. That's the most common places for a herniated disc. Typical how this happens is twisting and holding a heavy object away from their body while lifting. So improper lifting. Other factors are faulty posture, movement mechanics, weak muscles, and inflexibility. But holding something out in front of you and twisting, that is the most common way that somebody herniates their disc. Because the vertebrae squeezes the disc in such a way that it causes the jelly to pop out of the donut. So the sign symptom here, you have back pain right in the middle of your back, usually at the side of L4, L5, or L5 and S1. You have point tenderness over those areas. The muscle starts spasming. They can have sciatica, or they have pain that shoots along the nerve distribution. So that's why athletic trainers, physical therapists, doctors, and all that have to know where the nerve, the spinal cord, is connected back to. So we know that where L4, L5, S1, where they shoot pain, where they innervate. So they typically will be behind the rear end, shooting down the back of the leg all the way down to their foot. Anytime somebody says they have shooting pain down their leg, we typically will think that is a herniated disc. Treatment for here really is we need to get them to a physician. They need to have a CT scan or MRI, see what's going on in the spine, to see if they need to have surgery. Surgery shouldn't always be the last option. Typically we'll do physical therapy first to see if we can get there's no way to push the jelly back into the donut without doing surgery. So we're really trying to control pain at this point, ice the person, and slowly try to get them back to normal, pain-free life. It's a very difficult condition to have. I think this is our last injury we're going to talk about, is a burner or a stinger. Even though this is a neck and a shoulder area, we're still going to talk about it here because it's a nerve condition. So the stretching of the brachial plexus. The brachial plexus, you can see in the picture there on the neck, that cervical spine. There's also, not only are there nerves, there's arteries and veins that come out of the spine, but those are the brachial plexus are the upper nerves coming out of the cervical spine, and they go all the way down into the shoulder. So what happens here is that the head is forced in one direction. Head is forced in one side, as the shoulder is forced in the opposite direction. So you can see in the picture what that looks like. The shoulder goes down one direction, the head goes in the opposite direction. So our signs and symptoms here: numbness or tingling in the arm or hand on the side of the injury. So if they get hit, this happens on the right side, it'll be on your right hand and arm. You can have hand or arm weakness, so they're not able to. We can do the fingers. We do the finger squeeze test. You put your finger in their hand, and you have them squeeze with both hands. And typically, the involved side is much weaker with the finger squeeze. We test the bicep curl strength from both arms. Again, typically the injured side will have decreased bicep curl strength. If the sensation and strength returns to normal within 5 minutes, they can return to play. If it lasts longer than 5 minutes, keep them out, ice, and have them seen by the doctor. Because this could be turned into a chronic condition. Well, it typically does. If it happens once, the person may have it happen quite a bit. So we can start working on neck strength, shoulder strength, and make sure that doesn't happen for them. As a review, we talked about spine anatomy, different spine conditions, upper and lower back strains, herniated disc, and burner or stingers.